Hi everyone. Last time we have seen psychotic disorders, and under that we have seen schizophrenia, mood disorder, delusional disorders. Today we will see neurotic disorders. In that we are going to see definition, causes, classification. First we will see definition. It's a simple form of psychological disorder where patients show excessive or prolonged emotional reaction to stress. Previously, I said that anxiety is a universal. Every human being will experience anxiety. But if it is prolonging for long, for at least 6 months, so that may be termed as a disorder. So, when there is a prolonged emotional reaction to stress, that will be termed as neurotic disorder. It's a very simple form of psychological disorder. The common symptoms related to this condition are anxiety, fear, sadness, vague aches, pains and other bodily symptoms. The basic features in these conditions like tension, fear, worry, which leads to disturbance in normal functioning. That means the patient cannot able to work daily life. At least they cannot do their self-care activities. These people are very anxious and have one or more symptoms like phobias, obsession, compulsions, which are ineffective attempts to deal with anxiety. These neurotic people have the feeling of inferiority and inadequacy, and day to day problems are seen as difficult and threatening to them. They are constantly under tension and worry. They are very sensitive and more emotional and less reliable, and even they are possessive, insecure, selfish and more likely to depend on other. Their interpersonal relationship with others is poor, and for example they are confined in a psychological prison in which the mind is both jailer and prisoner. So these are the symptoms of these neurotic patients. Next we'll see causes why this will occur. First cause is an intrapsychic conflict. Intrapsychic conflict. Conflict within the mind. So that is intrapsychic conflict. This patient, if suppose he cannot decide or he cannot choose any solution or two solution which through which conflict will arise. And next one is the interpersonal problems, like problems in a family, at work, with others like friends, neighbors, etc. And environmental stress, loss of loved one, failure, that might be a love failure or any kind of failure, disappointments and frustrations. So that all comes under environmental stress, which causes neurotic disorder. And individual susceptibility. This depends upon the personality type of the individual. That means if they had any early life experiences like broken homes, parents divorcee or any kind of trauma in childhood, the personalities, so this is also might be a cause. So before knowing neurotic disorder, we must know difference between psychotic and neurotic. Already we have discussed. Neurotic means they have contact with reality, but psychotic patient will not be having contact with reality. And psychotic patient always say that there is nothing wrong with them, but neurotic patient will complain about symptoms frequently, like they have headache, they have stomach ache, they have all the symptoms they will be discussing. So that is the difference between neurotic and psychotic. So if you wanted to read about neurotic and psychotic, check under psychotic disorders. Next we'll see classification. Classification. So it is neurotic disorders are classified into 5: anxiety disorder, phobic disorder, obsessive compulsive disorder, hysteria and hypochondriac disorder. So here I will be discussing briefly. In next session one by one we will discuss in detail. Anxiety disorder. As I said that anxiety is a universal human experience. When it is prolonging for at least 6 months duration, then it will be termed as anxiety disorder. And panic. Panic, it is a sudden attack of intense discomfort or fear or terror. Sudden attack, suddenly will get unexpectedly something you have seen, any object or anything. It's a sudden discomfort, fear or terror, that is panic. Next, phobia, phobic disorder. A phobia is an unreasonable fear of an object or situation. Some people will be having fear with water, that is a hydrophobia, or they will be having fear with closed spaces, that is termed as claustrophobia. Mostly girls will be having fear of lizards. So this are all is a unreasonable fear of an object or situation. So that is phobia. Next, obsessive compulsive disorder. Obsession and compulsions. So it is characterized by the persistent and uncontrollable thoughts and irrational beliefs that cause an individual to perform compulsive rituals, and then that will interfere with their daily life. For example, especially in our India, our moms, so they'll be cleaning kitchen or hall. So usually they will clean for number of time. They wanted to be clean always. So they feel that something dirty is there. It should be in a proper way, ordinal way. So doing rituals again and again, that compulsions. So which will interfere even with their daily activities. So that is obsessive compulsive disorder. Next is a hysteria. It's a common type of neurosis. Patients with hysteria have multiple vague bodily complaints which mimic neurological or physical disorders. Physical examination does not reveal any abnormality, and the investigations all will be found out as negative. But they complain about the symptoms, physical symptoms, bodily aches. Next, hypochondriac disorder. So, in the hypochondriac disorder, these patients are very anxious and too much concerned about their health. They believe that they had some incurable disease. So, they concentrate more on health. And they say that they have, if suppose for example, if they have headache, they think that there will be a brain tumor. If they cough, they feel that there will be there might be a tuberculosis to them. So that is hypochondriac disorder. So these are the common neurotic disorder. In detail we will discuss later in next session. Thank you. If you have any doubts, please message me.